How can I prevent my pelvic floor tearing during my delivery? This is probably the #1 question I get asked by my prenatal patients during their 3rd trimesters, and rightfully so. I wish there was a way to guarantee a zero tear outcome. The truth is, birth is unpredictable. But the good news is there are 2 really easy pushing tips that I'm sharing in today's video that significantly reduce the likelihood of pelvic floor tears and also make it easier for your little one to make their grand entrance. Tip number 1. Do not hold your breath while you push. Breathe through it. This is the most important tip I want you to take home. When we hold our breath, that increases the likelihood of pelvic floor tears. And sadly, this is still very much common practice to coach pregnant women to push by holding their breath and bearing down as hard as they can by birthing providers and support staff. But this is completely counter to what the body and pelvic floor need in this moment. The diaphragm, your main breathing muscle, and the pelvic floor work together as a team and coordinate within your torso. When we take a deep breath in and hold your breath, that actually increases the pressure inside of your torso, and the pelvic floor responds by contracting to resist that increase in pressure. If we're then trying to push to facilitate baby to come through with that increased resistance of the pelvic floor, that's going to make it harder for baby to come through and also increases the likelihood of pelvic floor tears as a result. I want to invite you to feel this reaction in your body right now. So take a moment and take a deep breath in and hold your breath, and then push down. Notice what happens to your body. Can you feel how it increases in this grip feeling? Can you notice how your pelvic floor tightens in response? And notice how the space between your sits bones narrows also. This is what's adding that unhelpful resistance into your body while you're trying to push your little one through. And again, why pelvic floor tears become more prevalent when we are pushing in this way. Now, try pushing with your breath. So take a deep inhale in, letting your belly expand. Keep that expansion and exhale as you push down. Notice how that feels in your body. Notice how much more softness you have throughout your whole system, how much more flexibility you likely felt of your pelvic floor, and how much more space was able to be maintained between your sits bones when you pushed that way. This is why the breath is so important when you are doing your pushing. When you do this during your birth, you want to inhale throughout the building of the contraction and use your exhale to pair when you push. Maintain that pressed out belly, fully expanded, as you push to really help facilitate that flexibility for the pelvic floor. Another way to remember this is open glottis, open pelvic floor. Our glottis is where our vocal cords live, and they actually have a relationship also with our pelvic floor. If they're closed, the pelvic floor actually partially contracts. It opens when our vocal cords are open, meaning that air and noise is coming through. So using your voice while you push is another helpful tool in this process to facilitate that flexibility at the pelvic floor. So as you push, using a low-pitched hum or a low-pitched sound, as you push, allows that air to come out and also helps to facilitate that flexibility down below. Tip number 2, knock your knees together. Many of us have seen women give birth in the movies, lying on their back with their knees pulled up into that wide frog-like position. This is still a very common practice in many hospital settings, and sometimes this makes it difficult for people to feel comfortable while they're pushing, or notice that it's really difficult to get their baby through the birth canal in this particular position. If this is true for you, know that you have an option. Knock your knees together and open your feet wider apart. In this way, many will find it easier to push because it increases the space between your 2 sits bones and increases flexibility for your pelvic floor. You can feel this in your own body now, even in a seated position in a chair. Notice what it feels like to open your legs into that wider frog-like position, and notice the space between your sits bones. They actually come closer together. Now compare that to bringing your knees together and open your feet wider apart. Notice what happened to the space between your sits bones. You likely can feel that they increased in space. So keep this tip in your back pocket to use as needed, and know that you can use it in a variety of different birthing positions, not only when you're on your back. I hope you found today's video to be helpful, and I'd love to know in the comments below which of these 2 tips surprised you the most, and what additional questions you still have left about your labor and delivery prep. If you plan on having a support person in your labor and delivery journey, I recommend inviting them to watch this video too, so they can also help remind you to breathe and also to know about the helpful leg position tip should you wish to use it. Thanks for joining me, and I look forward to catching you in our next video.